Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. The topic is alcohol role in erectile dysfunction. Yes, let's understand what erectile dysfunction really means. It means where a man cannot have full erection, or where the erection does not stand for long, so he cannot hold on to the erection, and then you start having failures at probably even impregnating a woman. So it has grades. That is, you can say mild, moderate, and the impotence when there is no stimulation at all. This could be explained as we go older in age, that the testosterone that we have produced at high quantity when one is young continue to reduce in value, in grade, in quantity, and you now find the potency of the man itself, that is the erectile function, reducing, just like every other thing in man reduces with age. The testosterone explains that experience of having reduced sexual arousals and being able to hold on to that erectile function is a function of the testosterone. But we can also do more harm to ourselves with alcohol, because alcohol has a role to play in erectile dysfunction. Alcohol in itself could affect the level of testosterone. So you can then understand that alcohol has effect in the hormonal aspect of this erectile dysfunction. It also has effects in the organic aspect of erectile dysfunction. When you now talk of vascular, that is the vessels, you talk of the red cells, the iron level in the person. The alcohol itself tend to reduce the quantity of iron, and in that way you are now talking of anemia. Anemia has been incriminated in erectile dysfunction, so you can see how too much of alcohol could affect. These exposition are so many that so many researches have been done. But one thing acceptable in this research is that alcohol really emboldens. It really removes all inhibitions. It makes man more daring, and so is exposed to making so many mistakes that part of it is even STDs, exposed to more STDs. But that is not the topic today. The topic is the role of that alcohol role in erectile dysfunction, which I shall put in the table form. The role of the medical laboratory scientist in looking at the parameters is also very important, because when you are talking of anemia, you need the medical laboratory scientist to confirm the anemia. When you are talking of your testosterone, you need the medical laboratory scientist. When you are talking of your high lipid, that is cholesterolemia in the person, where you have probably too much of the cholesterol, it is also a function that the medical laboratory scientists will perform. But all these I shall expose in the slide session. So join me as we move along into the slide session to understand more about alcohol role in erectile dysfunction. The outline: objective introduction, type of erectile dysfunction, alcohol and erectile dysfunction, laboratory diagnosis and treatment. The objective: to expose the types of erectile dysfunction, alcohol role in erectile dysfunction, the evaluation of some parameters, derangement, and the treatment available for this condition. The introduction: erectile dysfunction is very common, affecting millions globally, with prevalence rising significantly with age. from 0 -5% to above 50% in men over 70 years of age. This staggering prevalence could be higher in countries like Germany that has the tradition of alcohol consumption. So if that experience is true there, then one can really come to a very close conclusion that yes, alcohol really affects erectile dysfunction. ED is quite prevalent in Germany, affecting millions with rates rising significantly with age and risk factors. Studies show prevalence from 18 to 48% in middle-aged men, affecting about 1 in 4 45 years old, and potentially impacting 3 to 4 million men overall. Though many cases go untreated due to discomfort discussing it. There is a high prevalence of sexual dysfunction in men who abuse alcohol. Erectile dysfunction is the most typical sexual dysfunction, followed by low libido and early ejaculation. These are all conditions that you find in people who take too much alcohol. Increased duration of consumption of alcohol and lesser age of initiation when young are related to an increase in this prevalence. In Germany, a study was targeted at 45-year-old men, and it was found that 25.2% overall had prevalence of this erectile dysfunction, with severe cases of 3.1% and moderate at 9.2%. The risk factor remains prevalence can soar to nearly 69% in men with multiple risk factors, that is, those who have diabetes, poor health, or are even depressed. The other contributing factors could be age, health condition, just like we mentioned, health, high correlation with diabetes, hypertension, and lower respiratory tract infection, the lifestyle, obesity, mental health, depression, and people are always not ready to come out to say they have diseases. Alcohol and erectile dysfunction. A study on both male and female. The study showed that following moderate alcohol consumption level of testosterone increase in women, but not men. This might be evidence of alcohol increasing the libido of women via a temporary surge in the male sex hormone. This was published in Nature. There are other key findings from case studies that shows high prevalence. Study shows that 40% to over 77% of men with alcohol dependence experience some form of sexual dysfunction, with ED being prevalent issue. The dose dependent effect too. The more alcohol consumed, the higher the risk and severity of sexual dysfunction. The impact of abstinence. A 2022 study found that 88.5% of men who with alcohol use disorder and erectile dysfunction saw significant improvement in their erectile function after just 3 months of abstinence. Other factors include age, existing medical conditions like liver disease or high blood pressure, and concurrent tobacco use can worsen the effect of alcohol on sexual function. This slide is very important because it exposes the mechanism of alcohol-induced erectile dysfunction. Alcohol contributes to erectile dysfunction through several physiological and psychological pathways. These are all what we call the type of erectile dysfunction earlier listed. When you talk of the central nervous system, there is that problem of the patient. Alcohol slows down the signal between the brain and the penis that are necessary for an erection. Then hormonal imbalance. When you talk of endocrine situation, chronic alcohol use can decrease testosterone level, a key hormone for sexual desire and function. When you now talk of vasculogenic damage, Long-term heavy drinking can damage blood vessels and nerves, impairing blood flow to the penis. Now, let's talk about dehydration. We all know it is alcohol-induced urine diuresis. Alcohol acts as a diuretic, leading to dehydration, which decreases blood volumes and flow. Then, when you talk about the psychological factor, alcohol abuse can lead to anxiety and depression. That is very important. And relationship problem, all of which negatively impact sexual performance. So, the little side effect of alcohol after a while, it now causes depression, and that depression is also part of the mental problem associated with erectile dysfunction. Now to laboratory diagnosis. The laboratory sample collected depends on the provisional diagnosis of the cause, especially if it is the organic type. Like I earlier mentioned, blood sample for vasculogenic type, where you are talking of hypercholesterolemia, you want to do lipid profile test or even check the heart, how good the heart is, or safe from ischemic heart disease. You do the troponin and other heart test, but troponin is very specific. Iron estimation too, where you are thinking of anemia, PCV, etc. Then if it's neurogenic type, you are thinking in terms of fasting blood sugar, random blood sugar, and glycosylated. Parkinson's disease could, because you talk about neurogenic, people who have Parkinson's dementia and co, they usually suffer from it. Endocrine type, like I exposed women research on total testosterone increase, the FSH, LH, thyroid hormone in cases of low testosterone. These are all tests, even more than this that can be done. Finally, treatment. Treatment depends on the cause, which could be obtained by confirmatory diagnosis in the laboratory or through imaging, and where it is a psychological problem, especially in youths, children, through questionnaire or interrogation. The doctor knows how best to get that. Where there are no underlying condition, then aphrodisiacs will be very helpful as a recommendation. Apart from using Viagra, that is so commonly abused these days, some erectile dysfunction may require intracavernosous injection of mesenchymal stem cell into the corpus cavernous of the penis, as shown in the diagram above, to improve erectile function by enhancing the blood supply to this organ and its innervation, penile, vasculogenic and neurogenic erectile dysfunction. This is the approach usually used. We know that the penis is made up of these elastic tissues and fibers, so that if you are able to directly inject the stem cells, then you are more or less regenerating it. There are over 210 videos in my channel. Just watch and watch and watch.